You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Well, in today's episode, I want to do a little discussion about total knee replacement. So for some of you listening, you may have knee pain and knee arthritis and are thinking about or planning to get a total knee replacement. And for some of you, you may have already had a total knee replacement. So in today's episode, I want to talk to you about things that I discuss with my patients prior to surgery, just so that they are aware of and that they know that these things are commonly seen after total knee replacements. We may have a whole nother episode that talks, in more detail about knee replacements, the rehab or the complications, but these are all very common things that people see or have or go through after total knee replacement. And if you don't know this going in, those people can be unhappy with the outcome because they believe that this is an issue or complication. But if people understand that this is normal and common, then they're going into surgery with the realistic expectation of what they will get. And also for some people that I meet, there's a lot of fear involved when they have these things and they're not sure if they're normal or not. Just letting them know that what they're seeing, feeling, or going through is normal puts their mind at ease. So, knee replacements, first and foremost, it's going to feel warm, and it's a lot more warm to the touch in the beginning, and this will decrease over time. Studies have been done that have looked at the blood flow that is increased to the area around the knee, sometimes for a year or two. So if you have a normal knee on one side and a replaced knee on the other, and you put your hands on both of your knees, you will notice that the knee replacement knee is warmer. And then even as that warmth goes down, what you may notice is after you go for a long walk or bike ride, you may have a little bit more warmth in that knee. So that warmth does not necessarily mean that you have an infection. Yes, if you have an infected knee, commonly they feel warm, but more often than not, knee replacements will feel warm, and it does not mean that you have an infection. The next thing, which may seem quite obvious to most of you, but when you have a knee replacement, there will be a scar. I actually get asked this question a lot. Will I have a scar? And currently there is no way to do the surgery without making an incision. And the scar typically is about 2.5 to 3 times the length of your kneecap. So if you put your knee out and you feel your kneecap, you can actually figure how many finger breadths your kneecap is and put your fingers above and below. And that's about the length of the kneecap, because in a small person, they have small bones and they have a small implant. So we don't need as large of a space. But in a larger person with large bones, the implant's bigger. So you need a bigger incision to get the implant in there. So there will be a scar. And then when we make the scar over the front of the knee, there will always be some numbness on the outside, or what we call the lateral side of the knee. So if you take your right hand on your right knee and you put it to the right side of your kneecap, there'll be an area out there which can be sometimes as large as a silver dollar, sometimes as small as a quarter. But what this is are these little tiny nerves that are in the skin that we can't see with the human eye. And when you make an incision over the front of the knee, those nerves run from the inside to the outside, and they control just the skin sensation, not any muscles. So when we make that cut, what you'll feel is some numbness on the outside half of the knee. And then over time, that numbness will start to disappear. I've had patients say they feel like shock-like zingers, that they may believe these nerves are coming back to life. And nerve regeneration can go on for quite some time. More often than not, the way that I'll describe it is if you have a large tree and you cut a large branch down, that big branch itself does not necessarily grow back in and fill in the gap of the leaves, but the other branches will fill in over time. And that's what I believe may happen more in the knee, because people will describe this sense of the nerve sensation getting smaller from above and below, and that area will start to go away over time. But even at a year, 2, 3 years down the road, you may still have a little patch of skin that feels a little numb on the outside. Now, the next thing, knee replacements will click. So clicking does not mean that something inside is broken or loose. Now, in a knee replacement that's been in for a long period of time and the plastic wears out, yes, the clicking will be a sign of the dysfunction. But even early on, you will feel clicking or hear clicking inside your knee. So if you listen to the arthritic knee, a lot of people describe that snap, crackle, and pop of the abnormal surfaces rubbing against one another. But in an artificial knee, you have metal rubbing against plastic. And in all of our joints, there's a little micro separation of less than a millimeter or so between the surfaces. So in a normal joint, those soft cartilage surfaces, when they come back to touch one another, it's almost like taking two wet sponges and touching them together. You don't hear or feel anything. But if you take metal and plastic, take a plastic aspect of a pen and touch it against something on your desk that's metal, you'll hear and feel that click. And that's what can happen in the knee replacement. When those surfaces micro separate and then touch, you'll hear or feel that click. It's more pronounced in the beginning because you're super aware of your knee. And it's also more pronounced in the beginning because you're going to have some swelling, which will cause some more separation between the plastic and the metal, especially underneath the kneecap when you're laying in bed. But then over time, as the swelling diminishes, your muscle tone regains its strength. You'll see that clicking diminish. But even if you notice clicking, it's not uncommon and it doesn't necessarily mean something's wrong. Now, the next thing, kneeling. I always let my patients know that can't guarantee that you'll be able to kneel after a successful knee replacement. And why is this? Well, years ago, there was a knee society and they came up with a bunch of rules that wasn't truly based on science. And one of the rules at that time was you're not allowed to kneel. So nowadays, we do have a lot of people that can kneel, but a lot of people, whether or not they have a surgery for a fracture or a tendon or a knee replacement, that scar over the front of the knee can make the knee feel very strange or uncomfortable. So I'll get a lot of people that will say, I try kneeling and I can't because it's uncomfortable. So if you have a hobby or a job that requires a lot of kneeling, it is important to understand going into surgery that is a normal occurrence. Now, following knee replacement, you can use a knee pad directly on the knee, which sometimes helps. I actually have some of my patients get a pad or a cushion, something like you'd see in a little Johnny boat or rowboat, and you can lay that on the ground, especially if you're gardening or doing work in your garage, and actually put the weight of your shin on that so your knee is actually in space. And there's actually been some studies recently that have looked through these knee kneeling protocols. So if somebody starts every day kneeling on a soft surface and then every week increasing the hardness of that surface, most people, the majority of people at the end of that process find that they actually can kneel, but it's something to be aware of. And then also, because we've replaced your knee, again, it's not the whole knee. You're not bionic. It resurfaces the ends of the bones. So your bone is still yours. Your ligaments are still yours. Your tendons are still yours. So when people overdo it and get tendinitis or strain their ligament, just understand that just because you have a replaced knee doesn't mean that you're immune to potentially injuring the other structures around your knee. So you just want to kind of be aware of all of these normal things that can happen to your knee, even if you have a replaced knee. So I hope that answers a bunch of questions. Again, these are really common questions that I get from people all of the time, and I explain it to all my patients this way prior to surgery. Again, so they have realistic expectations of what they're getting themselves into going into surgery. But more often than not, I'll see people for second opinions that actually don't have anything really wrong with them, which is good. There's not an infection or a fracture or instability, but they have some of these complaints and they were concerned and wondering whether or not these were normal and will they go away. And once I explain it in this manner, I find that it puts them at ease that what they're going through is normal and that a lot of these things will lessen, diminish, or resolve over time. So thank you for listening. I am Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Stay safe, and I will talk to you next time. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.